Welcome to Lovely Esteem. I'm Lovely, the auntie you always wanted, the sister girlfriend you didn't know you needed, honey. You got to have self love to have self esteem. And here we know that God don't make no junk. So we're going to sit down, talk about it, and see how we can fix it, baby. Let's do it. Hey guys, this is Lovely with Lovely Esteem, and welcome to Healing Through Conversations, where we talk about just different mental health topics. We talk about ways to improve our lives, and today I have the honor of speaking with Dr. Christine Nguyen, who we kind of like had a small introduction on another podcast, but she was talking about oral ties and how she broke down how it affects the mom, how it affects the family, how it affects the baby, and how it affects you even as an adult, which is something I never knew we would even be talking about. She is the founder and director of a board certified and licensed occupational therapist. She received her doctoral degree. She received her Doctor of Occupational Therapy from the University of Southern California in 2010. Dr. Nguyen currently works in the private practice, which I'm so proud of her because girl bosses, I love girl bosses. And she serves as the director and founder of the Center for Infant Tethered Oral Ties. Yes. Thank you so much for being here.
Thank you, Lovely, for having me here. It's such an
please
honor.
Introduce us to you. Tell us all about the wonderful things that make Dr. Nguyen happy.
You are amazing. And I'm so happy the universe brought us together because here we are now on your podcast and I can share more of what I do and hopefully it can shed light on more stuff for parents to be, parents that are already parents, and even adults that might be having some of the symptoms that I'll talk about. So just to give a little bit of background on me, I've been in OT now for almost 15 years, which is insane to me. But prior to that, I was actually a behavioral therapist for kids with autism. And I wish I could go back in time and reevaluate all of them, because when I think back of all of those little kiddos that I worked with, so many of them were mouth breathers, picky eaters, restless sleepers, and then they had all those secondary symptoms of, poor sensory processing, poor regulation, and it affected so much of their day to day. And I feel like if we looked at their sleep and breathing and everything that was happening in their mouth, we probably could have reduced a lot of these symptoms. But I did that for about 10 years and that kind of fell on my lap. I was in college, I was 18 years old, and this girl sitting next to me asked me if I wanted a job. And I was 18, so I was like, sure, whatever, I'll work. And she said it was doing behavioral therapy with autistic kids. And it was like a dream come true because since I was very young, I always knew that I wanted to help kids. And around 13 or 14 years old, I watched that movie called Mercury Rising. Have you heard of it?
Yes.
With Bruce Willis, yes, where he helps that little autistic child, but it's so Hollywood, it's very exaggerated. But I remember when I watched it, I fell in love with kids with autism. And so in my heart, I knew that I wanted to work with kids with autism one day. So when I met this girl in my class and she asked me, it was like, oh my God, the universe hears me. This is amazing. And so that kind of opened the door into what occupational therapy was. And once I started OT school, it was just learning more about health and wellness. And what I love about OT is they're very big on meaningful therapy. And not just therapy where it's like, okay, come in, we're going to give you 5 exercises. You're going to do this 10 times a day for X amount of weeks. And it's like rote stuff.
Okay.
There's nothing wrong with having rote exercises. Sometimes we need it where we do certain reps of, certain things that we have to do to get our body stronger. But with occupational therapy, they look into your actual life and what's meaningful to you, what your job is, what your hobbies are, and we incorporate that into the actual rehab. And with OTs, it's like, I feel like they just look a lot more internally with their clients. and the whole aspect. Who's your support system? How do you feel? How's therapy even working for you? And so it always aligned with my personality and my character, because I'm very sentimental and I'm very affectionate and for me, it's all about love. And I love love so much. And I love that your name is Lovely too. So,
We
you
were
know,
meant to be. We were meant to
I
be.
I know. And I feel like it's so easily forgotten when we're working in healthcare, because when people think of healthcare, they think, okay, everything is medical, it's black and white, you're in, you're out. But we have to remember the person on the other side is a human being with emotions, with feelings, with sadness, with, everything. And if we're not supporting the entire person, that treatment plan is only going to go so far. So after years of, working for clinics, for schools, for hospitals, and for other people, I always felt like I was being held back. And obviously, I'm going to listen to whatever my boss tells me. But I was just like, I need a break free. I need to open my own practice. And so 6 years ago, I started to notice a lot of babies were having issues with feeding. And I've always done feeding therapy with, toddlers. And I always felt like something's got to give. We're doing all this feeding therapy and they're not progressing. There has to be something we're missing. And that's when I started looking a little bit deeper into their medical history. And a lot of these babies had tongue tie issues.
Mm.
Some of them had surgery, some of them didn't. And I started noticing the ones that did have the surgery, or at least had therapy to support, whatever issues they had, they did better in therapy and the outcomes were longer lasting. So I remember I said to my boss at the time, I was like, look, I think tongue tie is a thing. Let's go get these babies. And she said no. She said, if you want those babies, you go find them yourself. So I was like, fine, I'm quitting that.
I know, she said challenge accepted.
I know. And, this is a whole other conversation, but after I opened my practice, she called me and was like, you need to train me in tongue tie. You owe me. And I was like, I don't owe you anything.
Excuse me.
I know.
When you could have helped, you totally took me under. You said no.
I know. And so, I mean, that was like I said, that's a whole other conversation of dealing with like the competitive side and the nasty side of like running a business and being a woman. And
we'll talk about that later.
We will. Yeah, for sure.
We'll get into it.
Yeah.
That's good. No, that's really good. And I think let me explain why I was so interested, because we were talking a little bit offline.
Yeah.
I think that there are times when, like you said, where the universe it connects you with the right person, and you don't always have a chance to talk offline. Right. And I said, you know what, the worst that she can say to me is, no, Lisa, I'm busy, I can't help. But my thought was, one, when I heard oral ties, I had to look it up, because of course laymen call it tongue tied. We that's what we always say. Right. And you think that it only affects speech. You never thought, I've never even had the thinking, okay, so it affects your sleep. It can, and lack of sleep affects mental health in babies, infants, toddlers, adults. And I was like, let's talk about this, because I feel like so many people, especially being on the East Coast, we're a little bit behind in more of the holistic way approach to health, versus we are very technical about a lot of things. And that's why I really wanted to talk to you about this.
Yeah. And that's the very reason I opened my practice too, was I felt like it was it wasn't being acknowledged as much as it should be. And the more I did my own research on tongue ties, it was like I opened up this rabbit hole of, oh my God, it can lead to high blood pressure, illness, like just all sorts of autoimmune issues. And I had to know more about it, but I had to also start treating it right away. And the only way to do that is if I open my own practice. So I opened my own practice, and you're going to love this part too. The first mom that called me was a tongue-tied baby. And I was like, it was meant to be.
It was so meant to be.
I know. And I remember when I signed the lease, I was like, I have no business plan. I have no patience. I have no money. I have nothing. I have this whole space and I have no idea what to do. And I get this phone call, and it's this frantic mom. She was like, look, I forget if he was like 3 weeks or 6 weeks old, but she was
Wow.
like, look, I'm desperate. Everybody is turning me away because they don't work with newborns. He's had multiple surgeries already on his tongue tie. It's still an issue. I have no idea what to do. And I said, bring him in. And at this point, I had like one little play mat, one little toy. It was such an empty office, but it was filled with just so much collaboration, so much communication, and so much love. And when I got the history of this little baby, I was just so, my heart just went out to him because he's not even 2 months old and struggling with breastfeeding, struggling with bottle feeding. Mom is having all sorts of anxiety and depression and just all these feelings of what did I do wrong, and what more could I do for my baby? And he had all these surgeries already and it wasn't working. So we had to look deeper into why it wasn't helping him. But, just to kind of dive more into why this is important is I have a lot of props too. So I'm going to start pulling props out
Pull
to
them
show.
out. I'm ready for it. I'm like, I blocked off everything. I was like, we're going to talk about this. We'll break this podcast into 2s or 3s if we have to. I am all the way in. I'm in this.
I love it. Okay, so tongue tie is, like you said, the layman's term. The medical term is ankyloglossia. So underneath our tongue, I'm going to show you guys this thing. We all have that. We all have a different degree of it under our tongue. So here's our tongue. It's called a frenulum. It can be anywhere. Okay. So here's the really important part is we can't just look at a tongue tie and say, oh, you have a tongue tie, let's do surgery. We actually have to look at what the dysfunction is first. And if that dysfunction outweighs the function, and then we start to attack it through non-invasive stuff. So non-invasive for me, I'm very conservative. Unless it's severe and the baby is absolutely not feeding, not latching on, and they're becoming failure to thrive, then we don't rush to do surgery. The reason why is because a lip tie, a tongue tie, cheek ties, a high palate, and I'll explain all of that too. And a way a baby sucks, swallows, and breathes is it developed in utero already. So for months in utero, they're already developing compensatory habits. And on top of that, they're in a tiny space. So now they're being impacted by just like that gestational flexion. They're kind of stuck wherever, they're limited in their mobility, basically. So that adds on to the limitation that they have with their mouth. So when they're born, they carry over those habits to breastfeeding or bottle feeding. So if we jump and do surgery without looking at the full picture, those are the babies then that carry over the same habits. And those are the families where they're just like, we did this surgery, we paid all this money, they're still struggling, what's going on? And of course, there are babies that do well afterwards. Everybody is so different. That's why I tell every family, don't jump to make quick decisions, especially if the recommendation is to do surgery. We have to look at the full picture. So going back to what I said, here's my first prop, my big mouth. And I use this to show parents so it makes sense too. So our tongue is such a small part of our body, but it has such a big impact on so many aspects of development. So for a newborn, what I say to parents is, if we're only looking at your baby's mouth during breastfeeding and bottle feeding, we're missing 75% of the other functions that the mouth has. So before I talk about the other functions, I always start with the feeding because that's usually why they come to see me, is babies not latching for feeding and they have an array of symptoms. And so what I say to them is, in order for your baby to latch, they have to be able to open wide. So here's my other prop, the little baby skull. They have to open wide, and then the whole tongue needs to be able to lift up to cup onto the breast or bottle for the whole feed. So now go back, and if we think, if there's a restriction pulling the tongue down. So think of it like a rubber band. If there's a rubber band pulling the tongue down, the baby is now working against resistance. So if they can't keep that tongue elevated, the great thing about the human brain is it's going to kick in right away to figure out, okay, we can't lift up our whole tongue, but we need to survive. We need to get milk. What do we do? Those are the babies then that learn very quickly to bite down. If they're biting down and using the jaw to clamp onto the breast, this is where moms start experiencing a lot of pain, a lot of pinching, a lot of discomfort, and it can lead to premature stopping of breastfeeding. And so if we're not looking at the quality of the weight gain, we're going to miss a lot of these underlying issues. And so that kind of goes into, I think one of your questions too was, how does the medical world like address this? And where they fall short is oftentimes pediatricians will look at a baby. Here's my other prop, my little baby here. They'll look at a baby and say, he's gaining weight, everything looks good, go home. But moms are sitting there with cracked, bloody nipples. The baby has blisters all over their mouth. Baby has a head tilt. They can only turn to one side. They're getting a flat spot. The shoulders are tense. Their hands are stuck here. And it's like, how is this optimal? Yes, baby's alive, baby is gaining weight, but to what extent is that weight gain? So if they're always biting down, what happens is now we're going to go into the second aspect that the tongue can affect. If tongue doesn't have full mobility for breastfeeding, babies then bite down. If they're always biting down, that's going to create a lot of tension in their neck. If the neck starts getting tight, then by default, the shoulders get recruited. So these are the babies then that start breastfeeding like this. Everything is here and they're just scrunched up like a little ball. And I've heard parents being told, oh, that just means they're hungry. Yes, they're hungry, but this, if they're stuck here all the time, now it starts to affect everything below the mouth. So I think the question you asked was, what's like my quote? I have a lot of quotes, but one of my quotes is, when addressing the mouth, we have to look above the mouth and below the mouth. And below the mouth is an entire body. And if we're only looking here and we're not looking down here, we're missing all the cues that are happening here. And a lot of secondary symptoms that babies develop if they're scrunching up their whole body is the GI system.
I was going to answer that question. I was going to ask, can that particular, can oral ties kind of lead into the colic situation for a lot of babies?
Oh, absolutely. And I hate the word colic because it gets thrown at babies that cry. And it's like, your baby's crying for a reason. Let's not just call it colic and move on with our day. That's perfect, because now that goes back to what I said is we have to look above the mouth. So above the mouth is a brain. Their regulation, their discomfort, their cries, all their cues, that's their brain and their body's way of telling you, hey, I can't do this. I'm uncomfortable. Help me. Don't just say I'm colicky and leave me alone or force me to feed all day. So we have to look at what the cues are. But then below the body, so imagine too, this is what I tell every parent is, imagine every time you eat food, I tell you to do that. I tell you to scrunch up and try to eat. You'll be able to eat, but it's going to affect how you open your mouth, how you bite, how you chew, and how you swallow. And then once you swallow, if you're like this, imagine now your GI system has to digest against all of that tension, all of that co-contraction, and all of that kind of like squished up position.
And stress, the amount of stress and anxiety that the baby's under, that we always make the mistake of. I think sometimes as adults, it's like we cut off our brain from the fact that it's a living being.
Exactly.
And everybody experiences stress and anxiety. It's just called different things. The older you get, you can say what it is. But what you explained, that tension, that's now not only affecting the baby's neck and shoulders and back and growth, and sleep.
Exactly. Oh, well, I cannot wait to dive into sleep. But yeah, so then now their little bellies are so uncomfortable. These are the babies that are always gassy, they're always farting, they're either pooping all day or they're not pooping at all. And then they start, having all these spit ups, they're hiccuping, all that discomfort. And because they're newborns, they have to feed all day. So now imagine they're that uncomfortable and you're putting more milk into them 2, 3 hours later.
Mm.
And this might sound gross, but when I say it to parents, they're like, I get it. Imagine if you had the worst diarrhea and your belly is in immense pain, and I keep handing you food all day. I'm like, eat
Yes.
this, eat
Yes.
this, finish it. You're going to be completely miserable. So by the time you have to play and be a baby and do tummy time, they're not having it. They don't want to do it. So now the mouth not only starts to affect internally, it's affecting their motor skills. These are the babies where parents come to me and they're like, we don't do tummy time because the baby hates tummy time. Babies should not hate tummy time. If they're hating it, again, we have to remember that's their brain telling us something isn't feeling right. So they're not able to do it. They want to do tummy time. They want to move. They want to roll. They want to lift their heads. They want to feel with their fingers and feel with their toes. But if they're uncomfortable, they can't do it. So that baby becomes even more of a priority to do tummy time because we have to loosen everything up below the body. And I'll talk more about the tummy time because the misconception is, I hate the word tummy time too. Oh, I shouldn't say I hate it, but it's not the best term because when you hear tummy time, what do you think? Plop them on their tummies. And what happens is a lot of families aren't taught how to do tummy time. So they just take their baby and they plop them onto their bellies. Imagine me just pulling you out of bed, pulling you out of your chair, and just putting you face down. For one, your brain, again, your nervous system is going to be like, what the hell is going on?
Yes. Oh my God. What did we just do?
What did we just do? Exactly. And so they go into like a hyper extension to not be face planted. And because they're just like, I got to lift my head up. And even though that's a reflex, it's called like a Landau reflex where everything lifts up. But if they're using that reflex to stabilize the entire time, it's now inhibiting them. So I tell every family, tummy time is not just about being on their tummy. You have to start here. You have to guide them from their back, then to their sides, and then to their tummies. And all the movements are slowed, they're controlled. There's things that you're doing with your baby while they're on their back, while they're on their side, and while they're on their tummy. You can do it on your chest, you could do it over your leg, you could do it over yoga balls. There's so many different fun ways to incorporate tummy time that it doesn't always have to be in one position. And the other thing too is when we're moving our babies around, wherever their head moves, their mouth and their tongue is moving. And so this is another way to improve feeding, because when you're rolling a baby around, they're lifting their head, they're turning their head, they're now actively stretching out all that tension for this position in feeding. And so it's loosening everything up. So that way, when you go to feed them for their next feed, their body is like, I'm looser. I don't have to go into this default position.
Yes, right.
Okay. And so we talked about the quality of feeding. They need an optimal latch, quality of all the tummy time movements where the tongue can affect the body. So my two favorite, and also the two very reasons why I shifted my practice to only work with infants with tongue ties, is because of sleep and breathing. So we all need to sleep. We all need to breathe, whether we're a newborn, a toddler, a teenager, or an adult, or an older adult. Is if we are not sleeping and breathing correctly or well, everything else is going to fall apart. Think about it for yourself. If you didn't have a great night's sleep the night before, you're a mess the next day.
Absolutely.
Right? Sometimes even looking at someone is going to irritate you. And so, whenever I tell parents that, I'm like, think about your worst night's sleep. Now imagine your baby is sleeping that badly every single night because they physically can't close their mouth and breathe through their nose. And a few months ago, I posted a video of me closing a baby's mouth. And Lovely, I can't even tell you how many people had such negative comments and poor information about why I was doing that. There were comments that said, why are you forcing that baby to breathe through their nose? They're natural mouth breathers. Let them breathe through their mouth. Oh, this is awful. Somebody called child services on her. She's suffocating that baby. This is stupid. And of course, there was a handful of people too that were saying, that actually helps them a lot. That baby probably has a tongue tie issue that helps with palate shape, all that stuff. So it was kind of a mix, but I would say 70% of the comments were people that had no idea what sleep and breathing quality meant and why breathing through your mouth is so bad for your health, so bad for so many things. So I'll kind of break that part down too. But it just surprises me, even in this day and age with all the outlets of information where people can get information, so many people are still so ill-informed. And you probably won't be surprised by this, but the one medical person that you would think would get on this would help us, but they don't. Pediatricians. I love the pediatricians that we work with. I love that there's very, very few that are paying attention to this, but most of them continue to dismiss it. And they're calling it a trend. They're saying we're overdiagnosing tongue tie. They're saying that we're just out to cut all these tongue ties and that it doesn't do anything to help a baby. And what bothers me about that is there's so much more research now about sleep apnea, about orthodontic issues, about maternal mental health for babies that are struggling with feeding. And it's not even about making a mom breastfeed or telling her she has to breastfeed or what have you. It's just about helping to get the baby comfortable to breastfeed or bottle feed. There's nothing wrong with bottle feeding, but we have to make sure it's the right bottle, why we're using the bottle, and if it's the right flow. Because the downside to bottles is bottles are designed to do all the work for babies, and it can change the anatomy of the mouth for the worse. So, if a mom tells me they want a bottle feed, I say, okay, that's absolutely fine, but let's evaluate your baby's mouth to figure out why we have to go to that. We have to go to bottle feeding. So, when pediatricians say to a family, your baby's not gaining weight, or just deal with it, it'll go away, or just put your baby on a bottle, to me, that's such a disservice to the baby, to the parents, and then to the baby's future. Because, so this is where we're going to dive back into anatomy, is our tongue shapes our mouth and our face. And how it does that is, remember, in utero, the tongue is already, everything's already developing. So if a tongue is being pulled down and it's not allowing the baby to close their mouth and latch the tongue up there, the roof of the mouth starts changing. There's genetic components too. So oftentimes babies, start carrying over the hereditary of their family. And so that can affect it. But this is why we intervene right when they're born, because if there is a high palate and a tied tongue, we can address it right away. And so why this is important is our tongue, think of your tongue like a plunger. If it's always up there, it draws the palate down. So our tongue shapes the roof of our mouth. So if the tongue is not on the roof of the mouth and it's down here, the palate can get high and vaulted. Why is this important? So if the roof of the mouth is high and vaulted, the roof of the mouth is now pushing into the floor of the nose. So that is now taking away from airway capacity to breathe through your nose. So now you're more prone to breathe through your mouth. That can lead to a deviated septum. That can lead to more allergies, to getting sick, to catching colds, because if we're always breathing through our mouth, all that bacteria is just collecting and building up. Our nose breathing, our nose hairs acts as a filter system. So if you're breathing through your nose, it gets filtered out.
Mm-hmm.
So that's where, now true nasal breathing is two things. People think nasal breathing is if the mouth is just closed. But if your mouth is closed and the tongue is on the floor of your mouth, that's heavy breathing. So I have
Mm-hmm.
to do it. So you can do it with me right now. So what you're going to do is I want you to close your mouth
Mm-hmm.
and don't let your tongue touch the roof of your mouth. So you're almost pulling your jaw down. So
Mm-hmm.
your tongue doesn't touch your palate, and breathe. It's a heavy breath. So now what I want you to do is close your mouth and bring the whole tongue up to the roof of your mouth
And how
and
it
breathe.
opens up your nasal passage as
It,
well.
it opens it up. It's easier to breathe.
Yeah, and it creates less. What I noticed was immediately with the tongue more on the floor, you kind of breathe. It was more chest breathing, more
Yes,
right. So you kind of like
right,
felt yourself go up versus
right,
when it's at the top. It
right.
felt just more natural for me, but
Exactly.
my tongue stays at the top
Yeah.
of my mouth.
Good.
Thank you. But like
Yeah.
it still talks a lot, but it was
Yeah. Same. I have a pretty tight tongue tie too, but I talk a lot. I do all the things. And so, that makes a big difference is, oftentimes when I ask parents, how does your baby or your child sleep? And they say their mouth is closed. But then when I have them go and pull the chin down, the tongue is on the floor of the mouth. So
Mm.
that's restless breathing. Now, and you did it for not even 10 seconds and you can feel the heaviness. Imagine there are people, babies and kids out there that breathe like that all the time, whether they're awake or they're sleeping. And so what happens is your body has to kick into overdrive to keep you alive while you're asleep and to keep you alert while you're awake.
Mhm.
And again, that's the great thing about the human brain and body is it knows how to compensate and adapt when it needs to. But where that becomes dysfunction is if the way we're compensating and adapting, it might lead to more compensation and more dysfunction, and it creates secondary symptoms. So then that's where we need to intervene and look at, okay, where can we help modify? What do we need to get stronger? What do we need to address first? Where's the actual issue? And then is the next step surgery? And if it is surgery, we have to have a treatment plan to support the surgery afterwards. So, the breathing, you already feel it. If you can't breathe well through your nose, your body's working hard. That's where then those are the older kiddos that struggle in school. Because if
Mm.
they're restless breathing awake and during sleep, they're the ones that can't regulate in a classroom. They can't pay attention. So now the academics gets affected, the social interaction gets affected. And then those are the kiddos that get labeled as behavioral, bad kids, can't sit still, can't pay attention. They play by themselves. They can't function. And it's so sad because they're getting labeled things that they're not, and their body is like telling you, help me, I can't pay attention because of this, I can't sit still because of this. So that's kind of how sleep then can affect mental health and well-being, because those are the adults then that turn to other ways to help them sleep: drugs, alcohol, prescription
Sleeping
medication,
pills. Mm-hmm.
pills, and so many things. And it's like they're the ones that have also probably even tried yoga, meditation, all those things. And so I have this thing, I call it a 2-week rule, where if you're trying all the non-invasive stuff, therapy, yoga, meditation, tummy time, whatever, to help improve your sleep and breathing, if that's not working, we have to look at the anatomy of your mouth to figure out if that's what's holding you back from actually getting deep sleep. So now how this affects the orthodontics is our tongue, remember, it shapes the roof of the mouth. So if your tongue isn't on the roof of the mouth to help shape everything out, that's where then it can cause narrowing of the mouth and face. It can cause overbites, underbites, cross bites, all, it just changes the anatomy of the mouth. It causes a lot of dental issues.
Mm.
And these are the kids and adults that end up getting braces. And when I think back of like what orthodontists do years ago. It's like, oh my God, you shouldn't be pulling out all these teeth. You shouldn't be doing all these things. Because what happens is they put braces on and you take it off. And what do they tell you? Wear a retainer the rest of your life. And we never questioned it. We're like, oh, okay, we'll wear a retainer now. But why are you wearing a retainer? Is because the underlying structures are pulling your teeth back into that crowded position. So now the orthodontists that are functional orthodontists that understand all of this are looking at the anatomy first. Is there a high palate? Is there a tied tongue? Is there a tied lip? Is there tied cheeks? So that's where we address first, because if we jump and put braces in, but we're not looking at the underlying structure, those braces are only going to do so much. So, this is why we intervene with newborns and they have a high palate and a restricted tongue. We can address that and retrain the mouth to close and retrain the tongue to get on the roof of the mouth to help shape out that palate. So the other challenging part though is that the palate is a bony structure. So if it's already high and vaulted, there's only a certain degree that we can bring it down. But if you can at least train the tongue to lift up there during breathing, it makes a world of a difference. So those are all the 4 aspects for a newborn, which is sleeping, breathing, breastfeeding, bottle feeding, and tummy time. And it all goes back to their tiny little mouth and how it can affect so many things. But I always tell, families and everybody, and just, here now with you, is we can address a lot of these things if parents just get a screening and if pediatricians would just support them. Because the hard part, like I told you, is pediatricians just look at weight gain. So if a baby's gaining weight, to them, it's like, great, but you have to look at the quality of the weight gain. Otherwise, we're dismissing these little subtle cues, and those are the babies then that transition into the next stage with difficulty. We can dive into that too, but what do you think about this so far?
So many questions. I had so many questions. My brain was like, check out. Because I think that what really kind of stood out to me initially was when we were talking about, infants and being able to sleep, and us talking about moms who either breastfeed or bottle feed, and they feel like, you have those moms who have to breastfeed or bottle feed every 2 hours.
Right.
And thinking about how if the tongue isn't able to grip the breast correctly, how much air is going into their bellies.
Exactly.
So now you have a gassy belly, you feel uncomfortable, you're constantly, you're either laying back or on your side, you can't get that out. So now the baby starts to cry. The new mom who doesn't understand what's happening, then she gets frustrated. Then neither one of them sleep. So now you're building a habit
exactly
on a consistent basis. And now we're seeing a mom at 4 months, 6 months, the baby still doesn't sleep, but 2.5 hours.
Right.
And the mom can't get the rest that she needs to be able to function correctly.
Right.
So,
exactly.
So I think that one of the questions, I guess, would be, is there something that the parent can do? Because sometimes we have all kinds of scenarios in life. A baby may be born and the grandmother has to take care of the baby, or maybe the auntie, and you can't breastfeed. So like, what are some of the questions that a mom could ask the pediatrician to kind of prompt them to maybe look a little further into it?
Right. So I would always tell a parent to ask a pediatrician to at least screen the oral anatomy. Does my baby's mouth look and feel good to you? Is there a restricted tongue? Is there a restricted lip? So we actually have 7 frenum in our mouth. So the actual tie itself is called a frenum. We have the one under our tongue. We have under our lip, upper lip, lower lip, and then bilateral upper and lower cheeks.
Okay.
But like I said, it causes different dysfunction for everybody. And for some people, it causes none. But if there are symptoms with feeding, we have to look at it right away. So for a new parent that's going in, that's giving birth, even in the hospital, I tell them in the hospital right away, ask the nurse, ask the lactation consultant, can you screen my baby? Can you check all of this? Check his mouth. Tell me how it feels, how it looks. The problem with that, though, Lovely, that I've seen happen all the time is a lot of staff in the hospital and a lot of pediatricians aren't well trained in this.
I was going to ask that. Hey guys, this is Lee with the T, back with more mental health tools for our mental health toolbox. And I'm excited about this one because I love finding new avenues for people to be able to get what they really need. So today we're going to talk about, it's called Q Chat Space. The letter Q, chat space. It's so good. Their website is qchat.org. I'm looking at the website right now because one, you guys know I should have my glasses on, and two, I want to make sure that I get this information correct. Q Chat Space provides live chat-based discussion groups for LGBTQ plus and questioning teens ages 13 to 19. It is not a forum and there is no video or audio. Everybody is chatting during the same pre-scheduled time. Our chats are facilitated by experienced staff and volunteers from youth programs at LGBTQ plus centers across the United States. They are connected to some really good centers. They're connected to Centerlink, which I'm going to also do a video about, PFLAG, which I will also do a video about, and Planned Parenthood, which I will also do a video about. It's just another way for us to have open spaces for people who have questions or who are going through life and they need connections to someone in their community. Sometimes we feel like you should be able to talk to anybody, and that's not true, because your lived experience will not always reflect somebody else's lived experience. And I love having spaces or finding out spaces that can really help somebody. So it's called Q Chat Space, and their website again is called qchatspace.org. Woo! I'm excited about this one. Anyway, have a good one. Bye, guys. Let's continue the conversation.
I know. So if they don't even know what they're looking for, they're just sticking their finger in there. They're like, feels good to me. But if, if they don't know what to feel for, what kind of tension to look for, then that's where the disconnect is going to be. So what I encourage moms to do is, okay, let's say they screen your baby in the hospital and you're still struggling with breastfeeding, and then you go to see your outpatient pediatrician, she screens your baby again, or he screens your baby again and tells you everything looks fine, but mom is still having symptoms. That's when then I really, really encourage parents, get online, look for an oral specialist, look for infant tie specialist, find a lactation consultant that's well versed in this to do a functional evaluation. And there are more of us that are, getting out there, which I love. But what I also encourage is that parents also ask the provider, how long have you been doing this? How many babies have you been seeing? Because tongue tie is becoming such a popular thing, a lot of people are jumping onto this and they're not getting optimal training. So they're now treating these babies with poor mentorship or poor experience. And because babies change every single day, if they're not getting good support right away, that dysfunction, like you said, keeps becoming a habit. And then the mom and the baby get stuck in this loop that leads to now a lot of mental health stuff that's going on. Yeah. So, they just have to get good screening. And I feel like if a mom is being told your baby will grow out of it, you're just overthinking it, or they'll figure it out, or this is normal for a newborn, find another provider as soon as possible.
Absolutely. And, one of the topics that you brought up on the other podcast that we did together, you were talking about health insurance. And we were talking about like preemptive care versus post care, right? So having health insurance, do they even look at this as a viable option for the mom, and will they even cover visits like this?
Yeah, so that's actually a very big issue for a lot of families, is depending on their insurance. If they have insurance, some insurances will cover this, some don't. And because it's a dental procedure, it depends on the dental insurance too. So that's kind of like, I don't know if I want to say the political side of it, but it kind of is, and so a lot of people hit this wall where they're just like, my insurance isn't covering it, or I don't have insurance at all to even cover this. So they end up having to pay out of pocket. And all of that starts to accrue onto a family. And oftentimes families won't even get support because they can't financially handle all of that. So, I branched out of the medical system. So I am only private pay because of that reason too, is insurances wouldn't reimburse me for the amount that I would spend, the amount
Yeah.
of time that I would spend on a newborn. If a newborn came to me with feeding issues, they would literally say, you get 45 minutes, all you look at is feeding. No tummy time, none of this other stuff. And this is what we're going to reimburse you. And it's like, how am I going to get anything done in 45 minutes? And how are we going to improve feeding if I'm only looking at feeding, or if a baby is coming in screaming bloody murder? This is a baby that's dysregulated. This is a baby that needs movement, that needs sensory processing, needs tummy time, needs everything else but the feeding issue. And so, that became kind of stressful to deal with. And so, I meet so many different families that come from all walks of life, that have insurance, that don't have insurance, that have money, that don't have money. And for me, this is another reason why I opened my practice, is because I have the power and the decision to help every family, rather than saying, sorry, I don't take your insurance, go somewhere else, or sorry, you can't afford it, go somewhere else.
Yeah.
And, but again, I'm only one person in the bigger picture too. So that's where it is. Another challenge is finding other providers to support families that can't afford this type of healthcare. And I have colleagues that are, help a lot of families. I have providers that help a lot of families. And so it's really just about us coming together for the greater good of babies and humanity, because insurance seems to just get worse and worse every year.
And more expensive every year.
And we pay so much for it, and they cover so little. It makes
So
no
little.
sense to me.
That's why I always say, I tell people all the time, I'm like, you have to look at yourself in a very holistic way, because
Right,
you have to, yes, I understand that we pay for health insurance, but you really
right.
have to do a lot of
I know.
preemptive work for yourself,
I
because
know.
by the time you present to your doctor, now
Right.
you're symptomatic. There are certain things that
Right.
they can and can't cover. And like
I
we were
know.
talking about before, 15 minutes isn't really enough time to get a person to trust you,
I know
to get a full
exactly.
diagnosis,
Right.
and to give them instruction on what they can do until the
Right.
next time you see them again.
Exactly. I know. So it's just, it makes me so mad at our healthcare system, and all our money is going there. I'm like, where is it going? Where's it going?
There are
All these
lots of people who
babies.
have wonderful bonuses. It's all I can tell you.
I know. And I just feel for these families, because they pay so much money for insurance, and they end up coming to me having to pay out of pocket because their insurance doesn't cover it. Or the other downside is they have great insurance and they have coverage for occupational therapy, but then the OTs aren't trained in this. So
Yes.
now they have an OT coming to their house that's like, oh, your baby's so cute. Let's just stick a bottle in his mouth. Let's just play with him. And then parents come to me and they're like, I don't even know what that therapy was. I don't know what they did. They didn't even look at the tongue tie, or they looked at it and said it was no big deal. And then I look at it, I'm like, that's a severe tongue tie. And so, it's also finding the right providers too, because like I said, not all lactation consultants know this, not all pediatricians know this, not all OTs know this. All of my experience in tongue tie is all post grad stuff. Like, I
Mm.
had to do it on my own. I had to pay for additional courses. I had to pay for private mentorship. I had, to get shadowing and all sorts of extra learning, because I don't remember this even being brought up in any lecture. And I took a lot of pediatric feeding courses, and I don't remember them bringing up tongue tie at all. It was probably a sentence in a book that said, oh, if there's a tongue tie, it's called ankyloglosia. And that was
And
it.
they
It's
kept
like,
on going. But and one of the things that I think we can when I think when we're trying to attach it culturally, you have a lot of children who are born, and as they start to speak, they either have delayed speech, which could totally be something else.
Yes.
But you have delayed speech, or you have, we always say, oh, you can't say F's, or you can't say L's, or you can't say T's, things
Right.
like that may have led you to believe, maybe, you say, oh, it's because they suck their tongue. I mean, it suck their
Right.
thumb all the time, but it may be something for you to at least look into.
Right. Yes. So you bring up a lot of good points, and this is going to open up a more conversation on tongue ties for older kiddos and adults. So to address the speech thing is any sort of oral anatomical issue, especially if it is a restricted tongue, it can affect speech articulation. And these are the kiddos that do struggle with certain sounds, and people look at it as they'll figure it out, or, oh, it's so cute, he's saying I love you instead of I love you. And it's because he physically cannot lift the tongue up for an L sound. So, I always tell families to get assessments for your babies for major milestones during breastfeeding and bottle feeding, when you introduce food. So this kind of backtracking from speech, but food is such an important thing. And I can't tell you how many times I hear that picky eating is normal. Picky eating is not normal. Yes, they're toddlers. Yes, they're kids. They're going to like some foods. They're not going to like other foods. But if the majority of what you're giving your child, if they're struggling to eat it or they refuse to eat a lot of foods, it's not because they're vegan. I've heard that too, where parents are like, they don't like to chew chicken or steak, they must be vegan. Chicken or steak requires you to bite, to chew, to use your tongue to move the food around. And so picky eaters, a lot of picky eaters are the ones that tend to be on a beige diet. We call it beige diet because it's pastas, cookies, bread, cereals. Why? Because all they have to do is swallow it.
Yes.
They got to scoop it in and swallow it. And so now they're the ones that are avoiding foods where they have to bite, they have to chew, and then they have to swallow it. The other risk that these babies are put at as toddlers and kiddos is cavities. And that gets overlooked. And I'm out and I see little tiny kids with cavities and caps in their teeth already. I'm like, how did that happen? So for us, the first thing we ask them is not, do you eat a lot of candy? Our first question is, do you not have tongue mobility to move food around? Because when we're eating, if food's getting pocketed, we use our tongue to move it around. But if a child doesn't have tongue mobility, that food is sitting there. And because they're not stimulating it with their tongue, they're probably not brushing it either. And those are probably also the kiddos that hate getting their teeth brushed because it's just is sensory
uncomfortable.
overload.
Yeah.
Right. And also the kiddos that have like a very restricted lip tie on the top or bottom, it blocks the teeth basically too. So not blocks the teeth, but it comes down so low that when they brush their teeth, it hurts.
Because it rubs across that
right.
line. I've seen, okay, that makes sense.
Yeah.
I've seen that.
Yeah. So then they don't brush it, or they avoid biting foods like raw foods, apples, peaches, carrots, or what have you, because when you bite down, it pushes there. So now they avoid eating a lot of fruits and vegetables because it's physically uncomfortable for them. So, then now that's where it's like, if you're a picky eater, what does it affect now? It affects our GI system. Because if we're not able to chew our food, your belly now has to digest chunks of food that you're just swallowing. And if you're not eating a variety of foods, now your health is affected because of, calorie or nutrition deficit. So it's more than just the actual issue. Sometimes parents are like, oh, I have a picky eater. They get put in feeding therapy, Lovely. And I'm not kidding you. The therapy goals will literally say, we'll eat a piece of steak in 3 months. We'll take 5 bites of pizza in 3 weeks. And I'm like, that's not the issue. You're just force feeding this poor child now to eat foods that they probably physically can't even bite and chew.
Yes. Which and also so, that one of the questions I was asking about, it was about oral ties and recessed jaws, and also causing jaundice.
Right. Yeah. So, here's the thing too, is when newborns are born, there's an array of things that can come up, because we also have to remember they're in like a tiny little space for so long. And so if we're not moving them and stretching everything out, if there's issues here, this gets worse.
Mm-hmm.
Okay. So with a recessed jaw is, again, there's always a genetic component. There's, if a baby is breached for a long time, or they're stuck in a position, or they're not moving a lot, it can affect the anatomy of
Mm-hmm.
the head, neck, and face. But then the other aspect is, if the tongue's being pulled down and back, that's pulling the jaw back,
Mm.
pulling the jaw, and it's getting stuck in a position. And then add on to that, now, if your baby already is born with a recessed jaw and it's pulled back, if this is a baby that's uncomfortable during feeding and they can't do tummy time, where are they most of the time? They're here. So if
Mm-hmm.
they're always on their back, gravity's on the face, it drops everything back even further.
And the flat head.
And then now you get a flat head, exactly. And so, and that's an important part, is if the skull's being pushed in anywhere, that means the front of the face is getting pushed around. So that can affect
Mm.
the oral anatomy, that can affect breathing. And what is the solution? Everybody says, put a helmet on that baby. And I don't have anything against helmets, but if a baby needs a helmet, we have to look at where's that flat spot coming from, because a lot of babies are not born with a flat spot. It's getting worse because they're being left on their back, or if they have tension during feeding, they're only turning to one side. That side's going to get flat.
Mm-hmm.
And what happens is we put a helmet on this baby and you have this perfectly round head now. But if nobody was looking at how that perfectly round head was changing the front of the face, you're now going to have a baby with a round head, but they're going to be mouth breathing. Everything's changing here. So we always have to look at the whole picture on why we're doing that. So same thing with, even with jaundice babies, they need movement, they need light, they need the nutrients from their mom's breast milk, and they need that optimal feeding. And if they're not getting it, these symptoms exacerbate. And it just becomes this loop now where it gets accepted as, oh, this is just how a newborn is, or, oh, this is genetic, so we can't fix it, or I just have a colicky baby and that's just the way it is. So, it's like so many of these things get normalized where we can intervene, we can change it, we can improve it. You can change so much of like the internal structures, the physiology of the baby, the personality of the baby, and the overall well-being. Because if this lingers into adulthood, you're going to have an adult, which I'll use myself too, is I get TMJ all the time. I found out I snore during sleep. I I thought I was a true nasal breather. I downloaded this app called the Snore Lab. I absolutely do not breathe through my nose. And so, as adults, we end up with all these issues: neck pain, back pain, migraines, and it all goes
Mm.
back to what the mouth is doing. I'm not saying tongue tie is the root cause of everything. I mean, the human body and human life is so complex.
And
There's so many,
amazing. Yes.
and amazing, yes. There's so many things that could cause all sorts of things, but I always say, before you jump to diagnose, before you jump to surgery, before you jump to putting thousands of dollars into all these other things, let's just look at the mouth first. Let's look inside your mouth. Let's look at the tongue. Let's kind of backtrack from the current to as far back as you can remember, if you're an adult or an older child or what have you. Let's backtrack and see, where did these arise and how can we address it non-invasively first. So that's
Yeah.
a lot of stuff.
I know it's a lot of stuff, but it
Yeah.
also just kind of, it opens up conversation. And that's
Yeah.
what I do. Like, this podcast is all about opening up conversation, because if you don't know what to ask, if you don't
Right.
know who to ask,
Right.
and if you can't like advocate for yourself, it can be frustrating. So then you
Right.
kind of,
Right.
you pause where you were going to go. You may have had, you go to the pediatrician, or you go to your sleep apnea doctor, and you're talking to them and you say, hey, I'm a 30-year-old woman. I'm, I'm
Right.
constantly waking up choking. Um,
Right.
and I can tell you, just, we were having a conversation about, snoring. And just what you said to me about the jaw dropping back and the tongue not touching the top of the mouth, that's what happens when you snore. And you were
Right.
talking about how your body then kicks into fight or flight mode.
Exactly.
And
Yeah.
yeah, you can explain that because I don't want to go into the technical terms because
No, you said that perfectly. You are listening.
I'm telling you, it's so intrigued. I'm like, I'm gonna look like a stalker if I keep staring at her. But like, I'm so intrigued. I think that when we're talking about, I believe in a lot of holistic style medicine. What can your body can do so many beautiful
It
things for
can.
you. You
Yes.
just have
Yeah.
to train it to do those things. And
Right. Yeah.
and learning how to relearning how to breathe, doing
Right.
breath work,
Right.
practicing that so that when you go to sleep, your body goes, oh, we're supposed to do this if this happens.
Exactly. Exactly. And that kind of goes back to why I have parents that have breastfeeding issues do more tummy time with their baby. And they're always like, what's the connection? We're here for breastfeeding. Why are we spending an hour on tummy time? Is exactly that. We're retraining those habits. So that way, when you go to breastfeed your baby, the brain is like, okay, this is what we do, not this. And that's exactly right. Doing breath work, doing, body work, loosen up the body, just fix everything below the mouth, and then pay attention to what's happening above your mouth. All for adults is, what's your mental health? What are you feeling? What's helping you? What's not helping you? And then we're looking at the anatomy. Because like I said, if we're only looking here, we're not changing anything. And so it's such an important topic, and there's so many components to it, and it's so complex. But the bigger picture is, whatever the issue is, we can address it. But I also tell parents, not every issue is an issue. If we're trying to make a perfect baby, parents are going to be stressed out, babies are going to get overwhelmed. It's not realistic. So, kind of another catchphrase I tell parents is, if you look at your baby, I want you to look and say, overall, is my baby happy and healthy? Or every time you're with your baby, is your baby struggling more than 50% of the time? If the answer is yes, get support. If somebody is telling you no, find somebody else to help you. Okay.
Absolutely.
Same
You got
thing
to
for adults.
advocate for yourself.
I know you really have to. And, I have to applaud all the mamas out there, because they're usually the ones that come in and they look at me and they're just crying or so overwhelmed, because they're like, this is my last result. I found you on my own. I had to do research. I had to find people to build my own team, because in my gut, I knew something was off. And I've been told for weeks or months or even years that nothing was wrong, or that the baby or child was going to grow out of it. And they listened to their intuition. And that's not easy, especially
It's
if your
not
partner
easy.
at home is not supporting you, or your family's telling you you're crazy. It's
Yes,
like
and that
you start
leads
to think you
into,
are.
but it also, because my background is about mental health, and
Mhm.
one of the things that we were able to correlate so clearly was, if you're not able to sleep, your diet is going to be bad. If you're not
Exactly.
able to sleep, you're not going to be, your digestion is going to be bad. Your
Right.
mental health, and you're already a new mom with hormones raging through your body. You
Right.
already feel like everything that happens to this baby that's wrong, somehow I didn't do the right thing.
Right.
So, and then
Right.
if you don't have a supportive household, if you aren't in a place where you can protect yourself and your baby, maybe
Right.
your finances are off, all these things come
No.
into play. So now, not only do you have a baby who's not thriving, you have a mom who's not thriving, and that is
Right.
a setup for, just a dysfunctional situation.
Right.
But they expect this mom to somehow be able to wake up every
I
morning
know. I
and
know.
pull you had this baby and you should be able to
Yeah.
pull it together. I'm
Yeah.
like, you try not
I know.
sleeping,
I
having
know.
chafed breasts
I
or
know.
bleeding nipples,
Yeah.
and you have to work for 8 hours, and your
Yeah.
baby's crying. It's hard to find a babysitter. But if you don't
Right.
have family,
Right.
it's already expensive. We were talking about childcare the other day, and they were saying something crazy like, I think Nevada's childcare something like $17,000 a year. And
Oh
I'm
my
like,
gosh.
what do you do? like, how are you supposed to thrive like that? Because
I
like you said,
know.
if the moms have to come to you and pay you per hour what you're worth, and then she still has to pay for daycare,
Right. I
and
know.
then, it just becomes so overwhelming.
I know. Yeah. And those are the families where they prematurely just give up on everything. They stop breastfeeding, they just do bottle feeding, or they're forced bottle feeding. And it's just so sad. It's like everyone gets stuck in this loop, and there's so much support out there. So, or there is support, but it's not all great support. So,
Yeah, and I think a lot of the thing, like having this conversation with you,
yeah.
is so eye-opening, because I don't think that the only reason why I ever even heard of tongue ties, I was explaining before, my
Yeah.
sister had to have occupational therapy
Okay.
because she was having a hard time with her L's and like her
Yeah.
T's and her, things like that. So she
Okay.
went to therapy, and that was 30 years ago.
Wow.
And she
Yeah.
was at the Kennedy Center, but they
Mhm.
really focused on speech therapy, and they
Okay.
really worked
Yeah.
with them. But a lot of that was like licking lollipops,
Yeah.
or putting peanut butter on the outside of your mouth, or
Yeah.
which then you have to think about, are you creating this issue with regards to sugar dependency? What are we doing about teaching you about your relationship with food?
The
And
food, exactly. Yeah.
yes,
Yeah. And you bring up so many good points. I feel like at heart you're like an occupational therapist because you see all these things.
I try to pay attention, because I realize that most of us aren't unhappy. We just don't know how to, articulate what's happening. The younger you
Right.
are, the less you're able to really say what you have to
Exactly.
say. And like
Yeah.
you said before, that you can medically, I can tell you that I have migraines and that I have a tight jaw. That's so many things.
Right, right. Yeah, exactly.
Yeah.
But to comment on what you said about, the therapy, just sitting there licking lollipops and biting and chewing food is, so I do a lot of lectures now with speech therapists because I always tell them the same thing that I've been emphasizing is we can't just look here. Rote exercises are okay. If you need to work on tongue extension to lick a lollipop, great. But are you remembering to look above and below the mouth? If
Mm.
they're sitting there licking a lollipop, but they're looking over here, or their eyes are closed, or they're just not focused, or they're getting really stressed out, or
Mm.
really anxious about doing this, are you paying attention to those cues? Because that's going to affect the retainment of their learning to carry it over later in the next session. And the other thing too is whenever, we're looking here, oftentimes for like older kiddos and adults, if it's speech therapy or any sort of oral therapy, we're looking here and they're sitting. But then what I tell them to look at, what's the posture look like? Are they moving a lot in their chair? Are they leaning over? Are they
Mm.
are they struggling to sit and do this? Because that's also telling you the body needs help too, not just the mouth. Those are the kiddos and adults and babies or whatever that might benefit from physical therapy, occupational
I was going
therapy,
to ask that. Yes.
or maybe seeing a well-versed chiropractor to just loosen everything up so that they can sit upright, so that they have the core and the postural stability and strength to look at you when you're giving them explanations to help their focus so that they can retain what you're doing, do it at home, and then come back and do it again. Otherwise, if we're just sticking things here and poking and prodding here and putting food in their mouth, we're creating a lot of negative things unintentionally.
Yes.
So that was a good point. We have to look at everything. And right, feeding therapy isn't just about eating food, because we can end up inadvertently creating a lot of eating disorders too.
Absolutely. And also, I was thinking about, just when we were talking on the last podcast, just culturally
Right,
how this is received, because food and food and health in some cultures is such a big thing, and then you have other cultures where food is kind of like their love language. So
right,
feeding the baby, getting the
right,
baby plump, and
right,
then
right,
missing, and if, like you said, if the baby has cute speech, getting stuck on that and like praising that speech, which
right,
then makes it so that the family, they don't even hear the speech impediment anymore.
right.
They like kind of like, oh, that's just the way she or he
Exactly.
talks. But it's like, you have to look past that, because when you now are 13 and being bullied,
exactly,
like
yeah,
really just the long range effect of that I think we don't look at. Because
right,
how many times have you gone to school with somebody who had a speech impediment, or they may have stuttered?
right,
And maybe, I mean, yes, there's so many other cognitive reasons why that could happen, but just
right,
that, like you said, just those few milestone checks
exactly, right.
could help so much.
Right. See, Lovely, you brought another important topic is bullying. It happens. A lot of these babies that where everyone's like, oh, that's so cute. It's not cute when they're 10 years old and kids are making fun of them, you know? And so that's another thing too, is, and again, if there's like orthodontic issues, so many things that we can address early on to prevent or treat it is getting ignored. So, you know, I mean, bullying is such an awful thing and it's
Yeah.
leading to suicide. So, yeah.
Yeah, it's very interesting, because one of the things that I think oral ties and just looking into, because I wanted to talk to you and have some knowledge, but I realized as I was reading about a lot of the symptoms and a lot of the treatment, none of it really addresses real life situations. Like
Right.
you said, having to wear braces, the bullying that goes
Right.
along with that,
Right.
having a deformed mouth, like you said, with
Right.
regards to the tongue,
Right. Right.
people who still suck their tongue,
Right.
how it affects you when you were 3 is very different. How it affects you when you're 13 versus when you're
Exactly.
23.
Exactly. Right.
And also realizing that we're going to have babies, and not in addressing the generational just genetics of, if
Right.
you were born with it, maybe there's a chance your child,
Right.
and realizing that, oh, something may be a little bit, this might not be what we want it to be.
Right.
Yeah.
Right. And I mean, the whole genetics thing, I get so many families where they come to me and they say, we didn't think we could address it because it's genetic and I have this issue, or my wife has this issue, my husband, my parents, or what have you. So they think it's written in stone and it's not. And again, that's the amazing thing about the human brain and body is we can change it, we can retrain it, we can manipulate it, we can do so many things to modify it. Even for adults, I always tell adults when they come in, after we work on your baby, we get everything kind of done and situated, we can refer you out too and help you sleep and breathe better. So it's addressable at any age. And I mean, yes, genetics plays a big role, but it doesn't mean we can't modify it, or not modify the actual genetics, but
Yeah.
we can improve the baby, the child, and the adult.
Yeah, and really just open up the conversation, because it's like all of us, you have a lot of us trying to, I always say, not so much break generational curse, because we have generational wealth as well, but
Right.
opening up the conversation where you don't feel embarrassed because something is wrong.
Right. Exactly.
It's like, okay, instead of saying, what did I do wrong, say, what
Right.
is right? And what can I do to correct these
Right.
things? Because it was interesting. I was doing a webinar, and one of the ladies, she said, whenever I talk to my clients, I always start off with, so tell me what's right.
Right.
Tell me what's
I
good about your
love
day. Instead of
that.
us going into like
Yeah.
the dark place first.
Yeah.
And
Yeah.
I think that when you're talking to parents who are coming into you with so much stress, like they're bringing in the cloud, and you're like, so what good thing happened to you today?
Yeah.
What
You
what
know
good thing did
what?
the baby do today?
Yeah, I'm so glad you said that. I feel like I'm gonna start all my evals now with tell me something your baby does that makes you happy. I forget to do that because again, in my kind of zone two, it's like, you're in here. Let me help you. What's the
Yes, problem solving. Let's
I love
problem
that so
solve. Let's
lovely. I'm
problem
gonna do that now. I'm gonna start the sessions now with tell me something your baby did this week that made you happy.
I mean, because
Tell me something good. Yeah.
I think, especially with regards to mental health for you as well, being a doctor, I'm sure when you go home trying to like take that cloak off of
Yeah.
everybody's,
Yeah.
trauma, trying that, even you're like, so what good thing did I hear today?
Yeah.
Like what
Thank you
good thing
for
that,
reminding me. Yes.
I mean, because
Yeah.
even for me, I always say, like,
Yeah.
whenever I'm talking to people, and people used to say, oh, they just dump. I'm like, not a lot. A lot of people don't want to dump on you. but they
Right.
don't. We never open up the conversation so that
Right.
people can kind of like say all the. They just need. Some people just need to say it, and once
Right.
it's off their shoulders, they're like, now I can address it. Now I can say, no, this is good. This is bad. This is
Right.
gonna work for me. This isn't. And
Right.
I feel like doctors all the time, all day long, you're just hearing,
I know. I know. Yeah.
and like sometimes you're like, when you hear about the good thing that
Yeah.
happened or like the positive, the positive reaction from the therapy, you're like, you're celebrating. The mom's like, it wasn't that big. And you're like, what?
Yeah.
Time work this time.
I love it. Yeah. I love it.
So I mean, and just I always think working on you and how you even perceive all of this. Off camera, you were saying how you worked in behavioral health
Yeah.
first, and how that really helped you to be able to connect with the parents. Can you talk a little bit about that?
Yeah, for sure. So when I worked in behavioral health, I was in like a locked psychiatric hospital. And, it's two different kind of mental health settings, but in that setting, it's like I'm working directly with an acutely psychotic person. Basically they're
Wow.
having an acute psychiatric break, and there's so many components to it because most of them were transferred from like state prisons or jails
Mm.
or off the streets, and so there were so many other mental health things, substance abuse, childhood trauma, a lot of stuff. And it really helped me to just listen instead of being quick to say to them, okay, this is what you need to do for your rehab today. It was listening to their story, listening to their history and just their life, and giving them a moment to just share that. Because if they've been in the system already, they're already being labeled and treated a certain way.
Mm-hmm.
And they don't get treated like humans.
Mm-hmm.
And it hurt me so much in those settings because I wanted to hug all of them. And my boss would even say, she's like, don't go hugging these inmates. Don't go hugging these patients. And I'm like, they need so much love, though nobody gives them love. It's so sad. And so that allowed me the patience that I have now when I meet with families. I'm able to sit back and just let them talk to me, to let them share everything, tell me everything, because everything that happened to you, even before this baby, is going to affect how we help your baby. Because if
Mm.
you're coming in there with trauma, whether it's anything, it could be anything,
Yeah.
it's going to affect that parent's perception of what we're doing. And then working in behavioral therapy with the kiddos, a lot of these parents were devastated to get a diagnosis of that for their child, whether it's autism, ADHD, cerebral palsy, anything. It's
Yeah.
already emotionally devastating for them. And they've gotten used to people just coming at them and telling them, this is the therapy your child needs, 5 days a week, 3 hours a day, this is what you got to do. And nobody was taking the time to ask the family, how are you doing?
Yeah.
So one of the big things that I carried from my past places that I worked is every family that comes into my office, the moment they sit down, I always ask them, who's supporting you at home? What does it
Mm.
look like at home? Do you have anyone helping you? Are there things that you need to tell me? Are there financial things? Like, tell me whatever it is, even if you think it's not even related to this. If it's hurting you, if it's bothering you, if it's on your mind, let's talk about it so I can help you find people to help you with that. Or if I can help you, even if it's just discounting a session or not charging them for a session, at least I can help in one way or another. And I'm not there to be their psychiatrist or their psychologist or their MFT, but when I know what's happening, then I can guide them on finding the right providers to help them with that. And if the least I can do is to get them a cup of water or to help at least financially with therapy, then I'm there to help them with that, because it takes away just that little bit in that moment for them to be present with me and with their baby.
Yeah.
And so,
Yeah.
I
I
know
was
it's,
like,
oh, lovely.
so
Yeah.
warm honestly, I think that our cultures,
Mhm.
especially minority cultures, we're taught
I
to
know.
not feel and to not cry
I know.
so much.
I know.
And that if you are going through something, you have to be very stoic and you stand
Yeah.
tall. And sometimes you
Yeah.
need a setting where you can
Right.
just release
Right.
those tears, because I tell people all the time, I do tips on,
Yeah.
tears release so much stress. It helps with your calming hormones. It gives you a moment to like refresh. And sometimes you need
Exactly.
that. It's like a language.
Right. Right. Yeah. I just want to share this really sweet story. So I met this family yesterday and I know they've been through a lot. And I don't know what we were talking about, love and just being present for each other and for our babies. And she asked me if I saw this speech by Joaquin Phoenix, the actor.
Mm-hmm.
And he quoted his brother, River Phoenix, who passed away. I'm going to read the quote because it's so beautiful. And I'm going to put this on my website. He said, "Run to the rescue with love, and peace will follow." I
Mm.
know. Isn't that beautiful? And I think of all my families that come through my door, it's like I run to them with love because I know when they come in, they are just completely overwhelmed already, and to hear that your baby needs surgery, these are moms that are just falling apart already. So it's like my office is supposed to be a sanctuary for them. I want them to feel safe there. I want them to feel at home there. It's a medical building, but it's like if I could create a space of love for you, then the therapy is going to be effective no matter what we do. And I always emphasize with them at the end of the day, I want you to be able to bond with your baby because when you're struggling with feeding and you have to do surgery, you stress so much that you lose moments of just talking to your baby, playing with them, smiling with them, cooing with them. So, all the therapy, the exercises that I show them, everything they do, I always say to them, get close to your baby. Let them hear you. Let her smell you. Let
Mm.
them just be in your presence. Lay down with them. Coo back at them, and it makes such a big difference. I've seen so many parents just smile with their baby for the first time. Even so many parents will even tell me, "I didn't even know how to play with I didn't even know I had time to play with my baby."
Mm-hmm.
And that's an important part is if they're not bonding with their baby, it doesn't matter what therapy or what surgery we do, none of that is going to be effective if there's no love between the parent and their own child.
And I love that. And I think that's the energy that I felt when you were speaking. One, I will say that your voice is very calming. I can
Oh,
tell that you
thank
talk
you.
to I can tell that you talk to like babies, and you because you want them to be able to one understand what you're saying, because
Yeah,
babies
of
understand you. They really their
course.
lives is so their eyes is so
Yeah,
alive. Their souls are there,
yeah,
but
yeah.
also you give off a very safe space
Thank you.
vibe. And that is, to me, when you are, like you said, when you are a parent, a new parent, or even if you are a parent with multiple kids and something
Right,
is wrong with your child, you have such a hard time
right, right.
adjusting. So being able to walk into a space where you say, I hear you, I
Yeah.
see you, you are important, the babe, everything. This is a whole cohesive group, and we're going to work on everybody.
Yes, yeah. Oh, I love
It makes such a difference. And I don't
you.
want to take all of your time. I could talk to you forever. I really
I
could.
know
This
I
is
could
so
talk to you forever
so good. But
too.
I so appreciate you taking the time
Thank
to come on
you.
here and talk to me about this. And believe me, I will reach back out to you because there's
Thank
so
you.
many more questions.
So many fun topics. We can talk about everything. I have so many things I could talk to you about forever.
Look, I'm very interested, but I want you to enjoy some of the daylight.
Thank you. You enjoy the rest of your night. You
I
gave
am.
your
I plan
evening
on
to
it. I
this.
really do.
Yeah,
I feel so grateful. And I just thank you
thank
so
you.
much for coming on here.
I appreciate you so much for inviting me to many, many more conversations.
Same. And I hope we connect
We
really
will for
soon.
sure. We will. Thank you so much, lovely.
Thank you, dear. I will talk to you soon.
Okay, sounds good. Have a good night.
You too. Bye bye.
Bye.
Thank you so much for joining us. We hope you found some healing, connection, and joy. Until next time, bye, loves.